Persian and Arabic scientists focused extensively on the translation, study, and analysis of Greek texts and ideas. Arab texts from this period contain articles on depression, mania, hallucinations, delusions, and other psychiatric illnesses. Authors who wrote on mental disorders and proposed treatments during this period include al-Baqi, al-Razi, Ibn Sina, and many other scientists. Some of the Bimaristans contained regions dedicated to the care of mentally ill patients. Bimaristans was the name of the hospital in that time. Middle Ages conceptions of madness in Europe were a mixture of the diabolical, the magical, and the transcendental. In that time, they were using a procedure called trepanning in treatment of mental illness. This procedure, in which there is surgical intervention in which a hole is drilled or scraped into the human skull. The intentional perforation of the cranium exposes the dura mater to treat health problems related to intracranial diseases or release pressured blood buildup from an injury. Other bodily remedies in general use included bloodletting and whipping. By the end of the 17th century and into the Enlightenment, madness was increasingly seen as an organic physical phenomenon, no longer involving the soul or moral responsibility. The mentally ill were typically viewed as insensitive wild animals. Harsh treatment and restraint in chains was seen as therapeutic, helping suppress the animal passions. The 19th century, in the context of industrialization and population growth, saw a massive expansion of the number and size of insane asylums in every Western country. A procedure called the Great Confinement or the Asylum Era. Laws were introduced to force authorities to deal with those judged insane by family members and hospital superintendents. Although originally based on the concepts and structures of moral treatment, they became large impersonal institutions overburdened with large numbers of people with a complex mix of mental and social economic problems. The success of moral treatment had cast doubt on the approach of medics, and many had opposed it. But by the mid-19th century many became advocates of it but argued that the mad also often had physical organic problems, so that both approaches were necessary. Psychoanalysis was the dominant psychogenic treatment for mental illness during the first half of the 20th century, providing the launching pad for the more than 400 different schools of psychotherapy found today. Most of these schools cluster around broader behavioral, cognitive behavioral, psychodynamic, and client-centered approaches to psychotherapy applied in individual, marital, family, or group formats. Negligible differences have been found among all these approaches, however. Their efficacy in treating mental illness is due to factors shared among all of the approaches, not particular elements specific to each approach. The therapist-patient alliance, the therapist's allegiance to the therapy, therapist competence, and placebo effects. In contrast, the leading somatogenic treatment for mental illness can be found in the establishment of the first psychotropic medications in the mid-20th century. Restraints, electroconvulsive shock therapy, and lobotomies continued to be employed in American state institutions until the 1970s. But they quickly made way for a burgeoning pharmaceutical industry that has viewed and treated mental illness as a chemical imbalance in the brain. Both ideological theories coexist today in what the psychological discipline holds as the biopsychosocial model of explaining human behavior. While individuals may be born with a genetic predisposition for a certain psychological disorder, certain psychological stressors need to be present for them to develop the disorder. Socio-cultural factors such as socio-political or economic unrest, poor living conditions, or problematic interpersonal relationships are also viewed as contributing factors.